Viewers, Assalamu alaikum. In third session, this is Dr. Ijaz Ahmed Tattla, and I think so you all will be happy and fine enough. Stay blessed, stay safe. I pray for your good health in this pandemic of COVID-19. This is the third session towards clinical supervision, and in this session, I would like to discuss with you the different options for supervisors, options for teachers. This is also known as the role of teachers towards the supervision, or what are the choices, what are the choices can be offered towards supervision to teachers. Options for supervision. Number one, basic clinical, peer observation, self-directed, administrative monitoring. In this diagram, you can see that with the stethoscope, a doctor is checking the chest infection of a patient. So that is about the basic clinical. And after his personal observation and information he would collect through different checkup, if he or she is not confident about his knowledge, he might refer to somebody else. That might be some peer observation. His or her peers can also supervise this accordingly. Third one is the self-directed. That means based on the self-knowledge, the observation, the supervision based on the self-direction. And administrative monitoring is also a strong sort of supervision. Let's see what are the steps involved in the basic clinical supervision. It is based on the pre-observation conference. The observers have to discuss in detail about its pros and cons, format, procedures, objectives, aims, and outcomes. Then observation is started. On the basis of observation, the information and data is collected. This collected information and data is analyzed strategically, and on the basis of this analyzed data, the results are some sort of, you may say, they draw a conclusion, they draw results. Shortcomings are highlighted and plus points are incorporated and go for next process. Then the follow-up on the basis of post-observation conference. Let's see what is the peer supervision. In peer supervision, colleagues may use a clinical model. They can process in processes confidential, collaborative assessment, reciprocity, reciprocally they check the things, facts and replies, required training, readings, is not summative. Whereas self-directed supervision is based on the following components: atmosphere of trust, esteem, appropriate goals, invitation to follow up, support for teacher needs, reward for good teaching. On the basis of these five components, self-directed supervision is done, as you can see in this diagram. There might be some certain passage or way to reach the peak of this height, uh, but he have made it the self-directed through some shortcuts, and his personal strength he is going to do to cover the way to reach the peak. That is the self-directed. You can see they have the atmosphere of trust and the self-esteem. On the basis of this esteem, they are supporting. You can also see somebody have uh, taken the other on his shoulders to support that. Administrative monitoring. In administrative monitoring, drop-in visits most of the times when you are visited, available feedback is taken. No intrusive, but not labor intensive. It provides a pulse, clinical advantages of clinical supervision. It is structured, helps new teachers, allows for different teaching styles. And the disadvantages of clinical supervision are it's time consuming, only announced visits, and it is structured. Whereas peer supervision is the advantages of peer supervision are peer esteem, reduction in anxiety, clearly formative, teachers' ID issues, IDs identifications, formation of monitor mentors. Whereas the disadvantages of this peer supervision are it's close, collaborative, trust, require time, requires training. सेल्फ डायरेक्टेड के एडवांटेजेस आप देखें तो इसका फोकस होता है ग्रोथ पर, और सेल्फ डायरेक्टेड फॉर मैच्योर टीचर्स के लिए होती है, और फोस्टर करती है ट्रस्ट को, मिनिमल स्ट्रक्चर होता है और सुपरवाइजरी सपोर्ट होती है। जबकि इसके जो डिसएडवांटेजेस हैं उसमें सस्टेन्ड इनडायरेक्ट इंटरेस्ट होता है, प्रायोरिटी इंटरेस्ट चाहिए नहीं होती, रिक्वायर्स रिसोर्सेज जो कम होते हैं, रिक्वायर्स फॉलोअप्स। वेयर एज एडमिनिस्ट्रेटिव मॉनिटरिंग के जो एडवांटेजेस हैं वो सुपरवाइजर विजिबिलिटी, इंटेंसिव सपोर्ट, कवर्स एवरीवन, कैन बी combined. Whereas the disadvantages of administrative monitoring are can be intrusive, snapshot only, occasional follow-ups इसके अंदर होते हैं. So when we have gone through different certain type of options of supervision, basic, peer, self-directed, and administrative, we have discussed it in detail, its components and types, then advantages and disadvantages of both clinical supervision, peer supervision, self-directed supervision, and administrative supervision. I would like something to discuss with you. Such like slides are very clearer to understand the things. At the same time, it's hot cake for teachers to make multiple choice questions. For example, I might say here, I can write close collaboration, trust, require time, require training are the disadvantages of peer supervision. या इस तरह ये लिखा जा सकता है कि disadvantages of peer supervision in clinical supervision are, आगे ए बी सी डी 4 ऑप्शन दे दूं यहाँ से डिसएडवांटेजेस में से, और एक लिख दूं पीयर स्टीम जो कि एडवांटेज है, और ब्रैकेट में लिखा जाए कि क्रॉस द इररेलेवेंट। तो अब जो डिसएडवांटेजेस हैं वो तो 3 ये लिखे हुए हैं, चौथा उधर से लिया है जो कि एडवांटेज है, तो वो इररेलेवेंट होगा, उसको क्रॉस करना होगा। सिमिलरली कहा जा सकता है कि administrative monitoring is the components of administrative monitoring are available feedback, no intrusive, no labor intensive, it provides a pulse. So provides के बगैर देखिए does not provide a pulse, so you can easily check and cross the irrelevant or relevant option out of the given options. So that's all about intensive. Rigorously, I have gone through the clinical supervision, its components, its parts, features, keys towards effectiveness, and so on. You should go through all this presentation, the components. If any query question is there, you may ask on Google Meet online, and you can comment as well on the Google class. I will be there for your to reply your questions. Thank you and Allah Hafiz.